All right. Well, welcome to another episode of Innovators of Health. Today we have Dr. Karissa Walton with us and Dr. Rahul Desai. And today we're just going to talk about what a badass Dr. Walton is, because that's what she really is. And just a little bit of background, besides being an entrepreneur, Dr. Walton is a founder of both Arizona Healthcare Freedom and Mobile Health Doc, based in Prescott, Arizona. She's known for her innovative approach to healthcare, offering a blend of conventional and naturopathic medical services. And so I'd love to dive right in a little bit into your martial arts background and how it sort of translates to um, what you do in healthcare.
Thank you so much. Thanks for having me today. I've been doing martial arts for probably about 15 years now, or maybe even more, off and on, just through college and medical school and beyond. I have studied Krav Maga and Brazilian Jiu Jitsu. I really ended up focusing in Brazilian Jiu Jitsu because it's a lot more sustainable and more technical. But I love the self-defense as well. But I ended up competing in Brazilian Jiu-Jitsu for about mm, probably like 7 years, something like that, and just came to really love it. But with any kind of martial art, even though BJJ is a little bit more sustainable and there's less injuries that happen, we're still putting people in joint locks and things like that. And so obviously you can have tendon injuries and things like that. So I came to really love regenerative medicine when I had to use it on myself. And then also my fellow athletes and competitors and things like that. So it's been a blessing to be able to do that for myself and for others.
Is that how you first got introduced to regenerative medicine, or when did you?
No, I actually had started it. I've been doing regen for just probably over 8 years now. So I was introduced to it when I was still in school and actually learned about it at a conference. There's a guy named Dr. Harry Adelson. He does a lot of stem cell treatments. He's based out of Park City, Utah. But he was the first one that really inspired me. And then I just started looking into it more and realized how much I love not only the medicine of it, but the science and just how it really helps the body heal. And it is the one thing that really taps into the body's innate ability to heal. And the fact that we can have a direct impact on that really just inspired me. And after being an athlete, even before martial arts, my whole life, I realized I could help people live better and move better and do what they love. And yeah, I just started to dive right in. I realized that that's the best form of prevention there is to get someone out of pain and moving well and able to just do what they love to do. So it was really cool.
So I would love to, maybe hear about your purpose around naturopathic medicine and your drive behind it, especially as it pertains to your experience with, Western medicine when it came to your mom, because I can share,
Mm, yeah.
similar experience from having gone through that as well.
hmm
So, can you talk a little bit about that?
Yeah. Right after I graduated from college, I was down at the University of Arizona. My mom was diagnosed with stage 4 colon cancer. And so I actually just went full on diving into her health and taking care of her. I was her primary caregiver. And so through that whole process, I had quite a bit of up close and personal experience with conventional medicine. And unfortunately, I realized all the shortcomings that come along with conventional medicine, especially in the oncology field. And I actually ended up pulling my conventional med school applications because of that and found a lot more answers for her through studying naturopathic medicine and just seeing that how much that impacted her quality of life. And, when a doctor tells your mom, she was 46 years old, and they said, "You're only gonna live 3 months no matter what we do," it's just kinda disheartening, and you don't wanna take that as an answer. You're like, like, within you, no matter what you believe, there has to be something more and there has to be better answers. And unfortunately, I don't think we give patients those answers sometimes in conventional medicine. There are, in cancer, there are some cancers that are very treatable with conventional medicine, but sometimes they aren't. And so it forced us to think outside the box and to look for other answers and solutions. And so that's when I ended up finding naturopathic medicine with her, and that's became my sole focus once she did eventually pass. I decided that I wanted to devote my life to that and helping patients actually get better. And ultimately, I decided that integrative oncology wasn't the way to go either. And I think that there's a lot of setbacks in that field as well. There's a lot of things that aren't available in the United States necessarily. And it's tough, because some oncologists don't even believe that there is anything outside of surgery, chemotherapy, and radiation. That is the only thing they will do. And so it's difficult to work in an integrative approach in oncology. And I think that's why I love regenerative medicine so much, is because it is preventative and it allows people to do the things that prevent disease. And so now I can focus on the forefront of prevention and really getting patients well so that hopefully they don't develop cancer, because there's so many different things that we can do before that. And movement is medicine. Regenerative medicine promotes better movement, allows us to do the things that we love to do, that allow us to move our bodies. I also am a big advocate for early screening and I get on my patients all the time, like, get your colonoscopy. I don't care. I'm like, go get it, because it's so worth it to catch something early, because prevention is the best cure. And I truly, truly believe.
Wow.
Amazing, amazing
Yeah,
story.
thanks. It's been a journey, but
When you got out of school, or when you had that experience with uh, naturopathic medicine, you went to naturopathic school.
mhm,
At some point there, you kind of, it sounds like you fell in love with regenerative medicine, and
mhm.
then um, after that, did you go like get further training? I saw that you might have trained with at the Reardon Center
Yeah,
clinic.
so back during school, it used to be called the Pain Relief Center. And then during school, they started transitioning it over to the Neil Riordan Center for Regenerative Medicine. And so they are still doing a research there. I mean, all kinds of things going on. It's a really up and coming center now where we can all study. So I started with kind of the old school prolotherapy. And I do think that's important because it does allow me to have that feel with the needle. And it's something like you can't really get through anything but experience. And so with prolotherapy and having that first, I think that really did help me develop just the intuitive part and the art of the needle. And then from there, I started to add on more diagnostics, more ultrasound fluoroscopy guided injections to be more precise. But sometimes that feel really does come in handy, because I'm very kinesthetic. And so I believe that's part of it too. Figuring out where the patient's pain is actually coming from is very important. So I loved that through training at Pain Relief Center slash Neil Riordan Center for Regenerative Medicine, I was able to kind of be part of that transition from the old school ways of regen to the new. And so I kind of have a really good diverse experience in that way. And yeah, it's been really cool to see how the field just continues to evolve. And it's been awesome to be part of that process and to learn about it at such a young stage in my career and just see the changes.
I'm kind of going the opposite way.
Yeah.
Uh, you know, I, and I'll explain more to Jay
Yeah.
later if he like. Uh, I'm a radiologist, right? So
Mhm.
very black and white, using image guidance and traditional uh, like pain management and interventional like spine and joint care really works for, and even like orthopedic surgery, like it works from inside out. So like the structures that we're seeing, like the spine and the discs, and treating those like really deep structures with imaging or doing surgery on those joints. And what Dr. Walton's talking about, Jay, is uh, all of the musculature, the myofascial system,
Uh-huh.
all those really superficial to deep structures. Uh, there is a whole field of medicine and art around treating those, like the myofascial trains and all of the structures that are significant pain generators and facilitate the way we move. And I've been introduced, to that over the years, and it's a totally different field. Like, and I'm continuing to learn. I just spent, last week in Minnesota at Rejuve Med, and Dr. Baumgartner is a master in that, and Dr. Seipel was there, and really learning. It's kind of a relearning for me of all those structures and how important they are in facilitating movement. And it's kind of like this inside out world. Like, we're inside, we're
Mhm.
going from the core out, and then they're going from the skin surface and fascia in, and then we're kind of meeting, right? And that's the cool thing. And so uh we're learning so much from one another, and for those doctors that are open on both ends, right? Because there's some that in our field, like in traditional allopathic medicine, they don't want to hear that. They're like, that's just a bunch of hocus pocus and it's BS and that doesn't work. And it's because they don't have these fancy imaging tools that they're doing this, right? And then on the flip side, you have the docs that, and this is a small camp, but on both, you're having docs that say, this is the traditional way, this is my ultrasound or my scanner. I don't need any of these fancy machines. And both of those camps are going to be left out in the cold, right? It's those that are integrative and truly like open-minded that are going to learn from one another, and that's what's exciting. I got to come down to Arizona and work with Dr. Walton and see her beautiful facility and how wonderfully she takes care of her patients, how much love's there. And it was awesome to see, and we worked together and learn together. It was really cool, but I think that's the future, to really bring in this kind of open-mindedness of what are the best things of allopathic medicine? What are the best things of, naturopathic medicine? What's out there in Ayurvedic medicine and ancient Chinese, medicine? Bringing all those things together, and the super cool, badass regenerative medicine and toys. And I'm a radiologist still at heart, so I like toys. So what are the cool new things that are out there? So anyway, I just wanted to bring Jay up to speed on it a little bit. But that's super cool that you had
Mhm.
that core and foundation, because I'm
Mhm.
learning,
Yeah.
and it's a steep learning curve. So I'm doing a lot of reading and understanding. It's going to take me a while to get to the level that I'm at with the other things, but I'm excited to learn.
Same
Great.
here. There's
No,
so
that's
much
great.
to learn.
One of the things that I'm curious about is how patients, find you, and what do they typically come in? What's their mindset um, when they come into your office? Because I like for our listeners, anybody who hasn't had an opportunity to meet you or is in a certain condition, contemplating, would, Dr. Walton be right for me? Walk us through that.
So we really do focus on a whole comprehensive approach to health and to the person. And so I'm always about meeting that patient on their level. And, everyone says, oh, lifestyle, lifestyle, nutrition, nutrition. But a lot of times patients don't know what that even means or where to start. And so we really do guide them through that whole process. And the cool thing about our clinic is we have a lot of tools to help them do that. Not just therapies, but I mean, thankfully in my program, I was trained in nutrition, the biochemistry of nutrition, and so I can really target what they need as far as nutrition advice. And we can do specialty lab testing, and so we can kind of dial in, really target those areas as far as what the patient needs. So one thing we do is micronutrient testing up front, hormone testing, hormone replacement therapy, bioidentical, of course, if needed. So I can really take a whole comprehensive approach to the patient's health rather than just sending them on their way and just, hoping for the best. Like, I don't want to just ever put a needle in someone without doing any of the groundwork. So even before a patient comes in and does a platelet-rich plasma or beyond, kinda we can talk about all that if you guys want, but, before they do any kind of regenerative treatment, I have them do a diet for at least 2 weeks just to clean everything up, make sure we're not injecting inflamed cells into an inflamed joint. That just doesn't make any sense to me. So I have them take a regimen of supplements, I have them do the diet, and really prepare their body to get the best results possible. And then one of my favorite tools I've been using is red light therapy before and after injections, and I think that has really helped take off with the patient's recovery process as well. And the cool thing about red light therapy that I love is that they can do it in the comfort of their own home and they don't need me. The goal is to not have a patient reliant on you. You can guide them through that process, but they still have to have tools to be able to heal on their own and recover on their own. And so when we started doing the red light therapy in the last year or so, or about, oh, maybe last year, um, the patient's recovery process has been a lot better for sure. And we do have panels in the clinic too. So if they don't want to get their own panel, um, they can they can still come in, but I like them to be independent. And so I like them to get their own panel because they can use it on themselves and their family and really recover better. Yeah, and there's other therapies too that can help, like IV therapy, hyperbaric oxygen therapy. We do have that available as well. It's just really just helping the patient as a whole heal to the best of their ability.
That's awesome. How have you what have you seen in terms of the before and after? So when you started using red light therapy with your patients,
Mhm.
what what did they expect, or did you have any expectations, and what were the results that you found?
Well, I will admit, in the beginning, I was a little bit of a doubter. I mean, it's different, right? Just like Dr. Desai just said, with the traditional prolotherapies, some of his colleagues think it's kind of woo-woo. And honestly, at first, I was like, okay, this is a little bit woo-woo. So I was a doubter at first. But it was the same thing for me in other therapies too, like hormone replacement therapy. I wasn't a believer in that for a long time, and I had to be won over. And so for me, I like to do my research. I like to understand the science behind it. And Dr. Desai has actually been really mentoring me in that area as far as understanding on a more scientific level how it is actually energizing our cells to heal and all of the cellular processes that are involved in that. And so I think once I started to understand the science a little bit more, that was what made me even want to try it. And then after that, I just had to experience it for myself and with my patients. But I did notice that most patients do have an immediate decrease in pain. Um, and that you can't make up. Either you have pain or you don't, and the fact that they can perceive that change, and it is happening on a cellular level, but they can perceive it that quick. It made me realize that there's more to it than just the science too, and that, clinically speaking, that patient is actually getting well and you can see them getting better and better over time. And like I said, I also like the autonomy of them being able to use the panels on their own. They're very safe. And just so for ongoing care, it makes sense for them to have something, that they can use in their own home to help with the recovery. So,
That's great. What did you experience personally?
yeah. Well, I feel like I feel like it's like this sounds woo-woo, but it's like a just an immediate comforting feeling that you get when the light is on. Like it's intense at first, like really intense. And I think when you're not used to it, you're like, "Holy moly, like this thing is powerful." And so it's almost like it packs a punch, like I mean, I used to do Krav Maga and get hit all the time. So when that light comes on at first, you're like, whoa, like, all right, we're doing this. And then it's like a calming, like comforting feeling that comes over you. And it's not like heat or anything like that. Like a lot of people do infrared sauna and things like that. It's not that. It's almost like you can feel it on just a deeper level. And so immediately, usually you can get like pain relief. Say, if I'm lifting in the gym or something like that, like immediately you can just recover better. It's kind of like a cheat code sometimes where you're like, wow, I should be sorer than I am, but I can still just go lift again and tomorrow or something like that. So it's
Yeah.
been cool just to aid in recovery. And for me, I don't want to have to inject myself. So if I can prevent that, then, I'll use the red light instead. So I'm not having to stick a needle in my shoulder because that's kind of difficult. So yeah.
Do you
Have
have
you
any?
noticed a difference in your like delayed onset muscle soreness or DOMS or
Yes.
like,
Yeah, definitely. Yeah. That's why I said it's kind of like a cheat code. Because we used to have cryotherapy here, but unfortunately we don't have it currently. So that used to be my old cheat code for DOMs and things like that. I'd just jump in the cryo chamber. But, I feel like red light is doing it has a similar effect, to that as far as getting that immediate relief and just I mean, even sleep and things like that, I've noticed, especially for my patients that have a lot of insomnia, like that's part of your recovery too, to prevent that delayed onset muscle soreness and just to be able to let the muscles repair. So it doesn't necessarily have to be treating the tissue where you're having muscle soreness. If you get a good night of rest, usually that can help with the recovery as well. So it's just kind of awesome that it has multiple functions like that.
I don't know if we talked about that. The more and more I've been learning about it, I came across some papers and some discussion on kind of we may have talked about, but the evolutionary biology
Hmm.
of red light, kind of the dawn and dusk. That's when
Yeah.
we get um, at sunrise and sunset, that first 15 degrees of light
Right.
has to pass through a lot more atmosphere and, just 400,000 years of that, like our body is used to waking up to red light and going
Hmm.
to sleep with it. And, it balances our circadian rhythms, it kind of modulates cortisol. At nighttime, it gets us into the rest digest, increases growth hormone, increases
Right.
melatonin, so we sleep better. And that's through the optic pathways, right? And then that also dramatically affects like brain health. There's all these studies on Parkinson's and Alzheimer's and neurocognitive decline. And just like sunrise and sunset, you need it every day.
Yeah.
You're not going to skip a
Sure.
day without sunrise and sunset, right? And so kind of the same thing. If you look at how the bodies we evolved with the sun,
Hmm.
right? That this medicine, and that's why I think it's another really important reason to have it at home or somewhere, if it's at work and you're able to go, if you have a gym membership that you can use it, but somewhere where you're going to use it on a daily basis. And then more and more, our protocols are really looking at leveraging the times of the day. So having it like in smaller doses, you don't need to sit in front of it for half an hour, but a 5-10 minute dose in the morning, a 5-10 minute dose at night. And then if you're recovering from a specific injury or area, then you can hit that a little bit longer at a separate time or during those. But that's kind of the sweet spot that we've been seeing, that not only is that leveraging for if we're doing an injection or somebody has an injury, but just that overall longitudinal health. This is something that I've become more and more passionate about as I'm learning about it, and it's something that should never be in the closet, right? It's unless you store it there and then take it out, but it shouldn't be put away, right? It should be something that you're using like daily and forever. So when folks have this, it's like brushing your teeth or, you know, flossing, or it is a health habit that should be like implemented. And the reason why, yeah, I think is so cool with, you know, with the sunrise and sunset, how natural can that's the most natural medicine.
So true. It's awesome that we can use technology to go back to nature. It almost seems counterintuitive, but it's true. And I think that there's a big movement for people to go back to nature. But kind of like I said earlier, people don't know how. They don't know what to do. Who's going to really get up and go out at sunrise? It's just in reality, like people have lives, they have kids. They need something that is dialed in for them that they can do and like you said, build that health habit every day. And it's something that's quick and easy for them to do, and they don't have to think about it. And I think that's really great because it is a way for us to go back to nature, but still use technology, which is awesome. And that's that integrative approach that
Yeah.
I love. So,
You know, we spend 90, I was reading a study that came out about a decade ago, and it's probably worse now. But we spend 93% of our time indoors or in a car, and we're animals, right? We're supposed to be outside, right? And I was with a group of physicians yesterday, and they were talking about how they manage stress and anxiety and other things, like what's their go-to biohack.
mhm,
And every single one of them said nature and outdoors,
mhm,
some form of that. Some was golf, it was hiking, exercise, but at the end of the day, it was getting back to nature and getting outside and connecting.
yep,
So it was interesting. This is, like you said, it's kind of a in this world that's so fast paced, and it's a little bit of a hack to be able to get that specific wavelengths that we've learned are very powerful at healing and
mhm.
bring them internally. But that doesn't mean you shouldn't go outside,
Yeah,
right?
please go outside. Please.
Yes.
We need vitamin D too, and I don't think the red light, unless I'm mistaken, but
No,
like that's not going to provide your vitamin D.
no, we
So,
need UV rays,
yeah.
right? So we need to get
Yep.
out in the middle of the day, and
Mhm.
uh, that's when the direct rays come through. So that's why the sky's blue. We see the blues and those the violets, and we need that ultraviolet to stimulate. There's an interesting study, especially where you are. There, there's so much concern of like cancer, skin cancer, right, and protecting against sun damage, and so everybody's like hiding from the sun. There's studies now that are coming out that there's actually photoprotective effects of the red light and near infrared. So when you get that stimulated, the when that red and near infrared hits your body and affects your cells in your skin, there's certain mediators and genes that are released and proteins that are expressed that are protective against cancer and getting exposure of UV. So the body's intelligent, right? And so when we were outside all the time, you'd wake up and you'd get the red and near infrared light, and you were protected against the hotter sun in the midday. Now we don't get that. We're in bed, we're in a car, we drive to work. And then if we get these high intensity brief doses of really intense light, our body's not ready, right? It hasn't. So some of the studies have shown that if folks are going to do even like tanning or UV exposure, which could be really beneficial, like vitamin D and osteoporosis, all the issues when you're not getting those rays, you get osteoporotic, you have other, medical issues. That this is one way of protecting the skin from those downstream effects. So doing red light or near infrared before a heavy dose of like sun exposure could be very protective. And I can send you that art. It was a fascinating
Yeah,
article
that's awesome.
about
I actually had
it.
not seen that.
Yeah.
That's really cool.
So in terms of innovation, one of the things that I find that is unique about you is your mobile, you know, your mobile concept. Let's talk a little bit about that because I think that's very innovative in your
Thanks.
field. I don't get to meet very many people who have a mobile health clinic. It's
Yeah,
awesome.
it's that has been talk about a steep learning curve. Mobile medicine, again, like it's kind of like old school meets new school. Um, going to patients' homes. That's what doctors used to do years and years ago, connecting with the families and just meeting them at their level, at their home, exactly how they live their lives each day. I think that's really why I love it so much. And I really think that without me realizing it, the seed for that whole concept was planted with my mom. When my mom was really sick, I just wanted someone to be able to come to her home or yeah, our
Yeah.
home because I didn't move in with her, but I just wanted a doctor to come see her when she was sick. And I'm not talking hospice. Hospice is great. There's a time and a place for hospice. But unfortunately, hospice, they just check in with you, give you your morphine, and kind of send you on your way. They're not going to give you an IV vitamin C drip or something like that that would really help, stimulate even just quality of life, you know?
Yeah.
And so I really wanted to provide that service to people that couldn't get out of their home, whether it's a debilitating disease like cancer or they're elderly and they just are having mobility issues and they can't leave or they're sick, there's a lot of reasons why. So I just decided early on in practice, this was right before COVID, 2019, that I wanted to do that for our community. And so I developed a fully functional mobile unit that has all the little high-tech toys on board of a Mercedes Sprinter van. And so it really is fully built out and it has basically miniature versions of everything that we have at the clinic here. So
Yeah.
I even have a tiny little mobile ultrasound and just a little infrared lamp. I've got all kinds of stuff in there. A
So cool.
portable hyperbaric oxygen chamber. So it's kind of like the techie stuff, but also, just being able to meet the patient in the comfort of their home, which is
So
awesome.
cool. Such a big need because I went through that in 2016 with my mother.
Hmm.
I was balancing the the hospital systems and what I needed from them by
Hmm.
taking her to a naturopath and having her do high dosage vitamin C, ozone, hydrogen peroxide, hyperbaric oxygen chamber. I mean, it was doing all of that for her. And, we weren't able to change the timeline, but we were definitely able to minimize the amount of pain that she would
Right,
have been in and in her final stages, you
right,
know.
right.
So it
Wow.
definitely helped. And I
Wow.
think mobile, your mobile concept would have
Yeah,
been huge at that time.
yeah,
So I'm sure it's beneficial now.
yeah, for sure.
That's
Yeah,
that's great.
yeah, it is. Well, I'm glad that you found those therapies too, because, back when my mom was sick, that it was not mainstream at all. It's
Uh,
becoming more mainstream now. And like I said, I saw her quality of life improve so much through that process, and it helped so much with the transition until the end when she couldn't get out of the house anymore. But I just feel very blessed that I found those therapies for her to really help. And I do believe it extended her life because she ended up living almost a year and a half after they had given her. And I don't like when they put timelines on things either in medicine. I don't believe that's really in our power to do that. And I think that it
yeah.
doesn't help families with the process either. And so, yeah, whether it did extend her life or not, I don't know, but I know that she was beautiful and glowing and was able to really transition in a way that was a beautiful process. And so anything I can do to help people with that process, I'm all about.
Do you have patients that come and see you that are in those predicaments?
Yes, I will say it's not as common now. So Um, just because we do have the brick and mortar now, a lot of patients do come into the office. When I first started, I was getting quite a few, especially cancer patients. Um, it's just kind of tapered down a bit, and especially since, I focused more on the regenerative side of things now. I will say it was very advantageous during COVID because I was able to go to patients' homes and keep everything isolated and treat them at their home. And so I'm very grateful that I was able to do that, and I learned a lot from that process. Um, so it's just not as common now, and I wish it was, but it's hard to do all of it, it's really hard. We only have one other doctor, and it's hard to keep up. So it's like I would love for someone else to be able to focus more in that area now. Um, yeah,
Yeah,
is
you
it
should see the van. It's pretty awesome.
yeah.
I have pictures, Jay, I can show you. I
Yeah.
when I was down there, I videoed the van and all of the tech, and yeah, it's a beautiful concept.
Yeah.
That's innovative. I
Thank
mean,
you.
that the fact
We
that
even
you're
have a
using it
hood
in
in there, so we can set up sterile field and have a hood to prep our IVs and all of that. Like we've got all the things. So yeah, it's pretty cool. I love it.
So what do you think patients should know about you that we haven't talked about? What if somebody's listening to this for the first time and they're hearing about you and your story?
Um, it's a good question. Um, I just want to continue to encourage patients to move their bodies. I think that's one of the best things we can do for our health. You know, so if we're talking regenerative medicine, I really do believe in physical therapy, strength training, all of that. And I have learned through my own health and healing that it's so important to move your body, even from a mental health standpoint. I think being in nature, moving my body, hiking. I just recently started mountain biking, which I never thought I would do, but there's so many different things that we can do for ourselves to find happiness and find healing. And I don't think we should limit that. And I think, I've learned that through my process, and I really want to teach others to do the same. And I think sometimes we get a little bit too rigid in our guidelines for health and what health should look like and what exercise should look like. And like I said, I like to meet patients on their level, figure out what works for them. There's always something you can do. There's always a way that you can find healing. And I love to help people do that, and I think we should encourage each other to do that and find communities in medicine that do that. And I think that that's what's so cool about you guys doing this podcast and all the people that you reach each day is that we all need to collaborate together and figure out a way to help patients get well. Because in reality, our country is very, very sick, and it's getting harder and harder to get people to that point because they've been fed lies for years, and people that won't even listen to them. They go to their PCP and they just spend a few minutes with them and send them on the way and fill their meds, and they never know. So I really believe that as physicians, we should be educating our patients, and we should be collaborating and working together and sharing the old methods, the new methods, all of it, and trying to figure out what works best for patients. And that's really my goal in medicine. And I know Dr. Desai is the same way. And I know you're here to help facilitate that. And I think it's awesome. It's a really exciting time to be in medicine, and I love the shift that's happening with people going back to health and going back to nature. And I just want to continue to see the field grow. So yeah.
With a few
How
minutes
can they
left.
find you? Oh, sorry, Jay. Go ahead.
No, I'm just gonna ask with a few minutes left, just
Yeah.
you said that you start people off on a certain diet and a few
Mhm.
supplements. I'd just love
Yes.
for people to hear about what kind of a diet and mindset around their diet that they can start to incorporate, and what are some of those supplements that people can start to take if they're not taking them already.
So, starting from the foundation, the nutrition, that's what we put in our bodies every day. I truly believe in more of an anti-inflammatory diet approach. And really what that means is eating whole foods. I have a whole handout, and it walks through each specific food group and what type of foods you should be eating. So say vegetables. These are the less inflammatory because there is some data that supports that some vegetables can be inflammatory, right? Um, and some people do have issues with things like nightshades, all of that. But without getting into too much of the weeds, it's mostly eating whole foods and avoiding any foods that are inflammatory. So if there's something that a patient's eating, I try to figure out what we can replace it with that's less inflammatory. But if you just cut out processed foods and eat whole foods and eat clean sources of meat, fish, vegetables, even some grains, a lot of grains can be inflammatory. But it really is just cutting out the crap, to be honest, and just eating clean. And I think that that's really important. And then adding on those foundational supplements, like one thing we've already mentioned is vitamin D. It's one of the it's one of the biggest deficiencies aside from magnesium that I find. And so really vitamin D, pretty much a lot of patients are on it because no one gets enough sun and they're not absorbing it from their foods. And so that's one thing. Um, I also usually do some form of antioxidant in there. And when I say antioxidant, I just mean something that decreases the oxidants oxidation, which can create free radicals and cause a lot of inflammation. So I have a supplement that I use that has that in it, a set of antioxidants. And then usually I will have them do, what else do I have them do? I don't remember my whole protocol. Oh, some form of collagen. Collagen is really great, or some kind of collagen generator. So vitamin C, along with there's certain minerals. There's a lot of things that can help with collagen production. So I usually do like a collagen and or a collagen generator because collagen can really help with the cross-linking and the repair. So I'll have them start that about 2 weeks prior, and so they can kind of prime their system. We can't do anti-inflammatories, so I do stay away from anti-inflammatories pre and post procedure just to make sure that they will actually have that initial inflammatory response. So I also have some supplements you can't take. So like curcumin, things like that that people use a lot for pain. Unfortunately, we have to figure out something else for them to do instead. So that's another good application for red light because they can actually use the red light for their pain before the procedure, and it's actually synergistic instead of taking something that could affect the treatment if we're doing a therapy like PRP. Um, so that's usually kind of how we set the foundation, and I've got a handout that walks the patient through everything.
Awesome.
Krista, do you know much about methylene blue?
I I've been researching it more, and I have started implementing it into practice, but not specifically with regenerative medicine. I'm mostly doing it for neurological and mitochondrial health. Um, but I haven't really explored it too much with regen. What have
Yeah,
you
so
found?
just by with the way that the photobiomodulation, the red
Mhm.
light, near infrared work, there's a lot of synergies with methylene blue.
Okay.
And was talking to some. I need to do a deeper dive into it.
Mhm.
Um, Tried a few doses of it myself, and I'm you know I'm a pretty good example of placebo
Yeah.
uh, effect, like on everything. I'm a believer, but it definitely I felt like it made a big difference in my focus
Yeah.
and mental energy levels
Huh.
without like kind of the caffeinated like jitters. It was a really, really, yeah. So I got a ton of work done over the past few days with, uh, you're just taking that methylene blue supplement. Very blue urine for sure.
Yeah.
Yeah. And
I
it's
have a
pretty, it
really
looks
funny
like,
story about that.
it looks like
But I
Windex,
don't know.
but it's, It's pretty interesting. So that's good that you're doing some
Yeah,
investigation.
I yeah,
Offline, we'll have to
I have
talk.
a few patients on it, but like I said, usually I use it in neurological cases. For example, I had an ALS patient that recently established care with me, so I put her on it right away and got her in the HBOT or hyperbaric oxygen chamber, and we're doing some other cool therapies with her, but I'm interested to see, you know, how it affects even, end stage disease too. But I mean, if we can prevent that through our mitochondrial health, especially things like Alzheimer's and all of that, like it's one of the biggest killers in our country, to some degree. So it's interesting, and I
Yeah,
do
that's
want
why
to
I'm
learn.
more and more I look at how we can leverage the photobiomodulation in our
Mhm.
everyday lives.
Yeah.
Looking at I've read some articles on the brain waste removal system.
Hmm.
I don't know if you've seen. I can send you that. And it's talking about the benefits of red light, near infrared light, at in the evening hours, and helping dramatically. Because I've seen that happen. Like I have an Aura ring and have tested myself, and really getting a ton more deep sleep. Yeah.
I
So
finally got one.
sweet. Good
Yeah,
job.
anyways. Yeah.
So if you look at your deep sleep and
Uh-huh.
heart rate variability, heart rate, sleep latency, there's a several parameters, but that brain waste removal system works every night. So our like beta amyloid proteins, those are the what creates the plaques in Alzheimer's.
Yeah.
Those build up during the day. So they've done CSF fluid testing where they took CSF and tested those proteins in the morning and at the evening, and they're much more pronounced in the evening. So
Hmm.
we have to get rid of it.
Yeah.
And the time that our body, it's kind of like the washing system in our brain, the time that gets rid of it is during deep sleep. That's when the blood-brain barrier opens up the most, and those proteins are able to come out of the central nervous system, and then they get eliminated. And if you have less deep sleep, those will build up, and over time, that could be one of the reasons that we're seeing so much, Alzheimer's and neurodegenerative disorders, is it's poor sleep, and any like sleep hygiene and other ways of doing that. And what they noticed was that red light's a really profound uh, source of increasing like deep sleep and kind of re-engineering like sleep architecture. So it's very interesting. So if you have those neurocognitive patients, something to think about is implementing the red light therapy. I can send you some. We built out some protocols. I can send you that too, kind of
Okay.
offline. We could talk more
Very
about it,
cool.
and then pairing that with methylene blue.
Wow. It makes sense. It really does. And we're learning I recently went to a conference and it was all about mitochondrial dysfunction, and we just keep learning more and more about how these mitochondria we speak of are involved in so many disease processes. And I think it's really cool that we can be on the front end and do everything we can to prevent it. And we have tools to do so now, which we didn't have even 10 years ago. So it's really neat.
I want to see that. Like, if you can send me some of that stuff on the mitochondrial health or whatever
Yeah.
that conference is, I'd
Yeah,
love to
I
go.
will. Yeah.
Please, that'd be awesome.
Dr. Anderson's conference. He's one of my favorites.
Yeah, I've heard. I think that's who is it Paul Anderson? Is that the?
Yep, Paul Anderson.
Yeah,
Yeah.
the doc who has gave me like that had that methylene blue was talking to me about that. I think he sent me some just today. Sent me some lectures on that. So I'm
Yeah.
super interested to dive into
He's
that.
he's awesome. And he's been preaching at us about mitochondrial health for years. And I think people are finally starting to understand it. Because at first it seemed like this whole foreign concept, like, what the heck? Mitochondria? What are you talking about? That's just the powerhouses of the cell. It's like, no, it's a lot more complex than that. And I think now that we're starting to get some of the science to support it and to help us understand it more, it's starting to take off. So it's definitely an up and coming field. So
Well,
yeah.
if someone's interested in connecting with you, what's the best way? How can patients find you?
Well, our website is azhealthcarefreedom.com. You can always request an appointment online. So that's one way. You can call us 928-298-3349. You can email us info at azhealthcarefreedom. I'm on social media. My Instagram is Dr. Walton, or AZ Healthcare Freedom, both Instagrams, Facebook as well. So there's a lot of ways to reach out. And yeah, we're always available. We've got a really good team here, and we do operate like a family. And I really love that. I love that community feel we have. So it's like in our town in Prescott, we say we're everybody's hometown, and I feel like our clinic does portray that, and how we treat our patients and how we operate as more of like a family and helping patients get well. So I'd
Yeah,
love
we
to,
felt that when we were there. I wanna come back.
yeah.
I
And
wanna come back for
we
Christmas,
have
it sounds
great
awesome.
weather. Yeah, and most people don't know we're Arizona's Christmas city. So we do a whole courthouse lighting, and like everybody goes out and sings Christmas carols together. It's a really cool town, and we have a ton of nature all around us, like lakes, mountains, pine trees. Doesn't even really feel like Arizona sometimes, but it
If
is.
we do training together in the future, let's do it in Christmas time.
Yeah, let's do it. I would love that. It's
Well,
so
cool.
fun.
Well, thank you again. Thank you so
Yeah,
much for being here with
yeah,
us. And, we look forward to more conversations
yeah,
and
definitely.
having you back on in the future.
Yeah, thank you guys so much for having me,
Thanks for your
and
time. That was
thank you for all you do.
you too,